They're words no one ever wants to hear.
You have a tumor, and next day you're in the hospital.
Starting down a difficult path full of twists and turns, heartbreak and hope. In good health, cancer often recurs, but what if advances in technology could keep you one step ahead of the disease?
Dr. Frank McGeorge here with some recent advances that are coming together to extend the life of brain cancer patients.
Malignant brain tumors are especially difficult to treat. Microscopic spread into adjacent areas almost guarantees recurrence in time, but medical progress is helping to keep hope alive even in the face of difficult odds.
It was 2006 when Christy Lehman of Traverse City first developed a problem.
I just blacked out once. Like my eyes just kind of went black.
After their evaluation, her doctor broke the news.
She came in and she's crying, and then the nurse that my family knew, she's crying, and we're like, okay, you know, what's going on? And they said, well, you have a brain tumor.
At the time, the doctors in Traverse didn't have much hope. Their advice?
We want you just to go home and live your life how you want to live.
Fortunately, another doctor directed her to Henry Ford Hospital, and over the past 12 years, she's undergone an awake surgery to remove the tumor, radiation, chemotherapy, radiosurgery, and laser ablation. At each step, medical progress keeping her ahead of the tumor's relentless advance. Dr. Ian Lee is one of the Henry Ford Hospital neurosurgeons taking care of her.
Over the years, she's had quite a few episodes of progression, and with this latest one, really our treatment options, she's mostly used up.
This latest recurrence poses some new challenges.
Where the tumor is located is a sensitive area, could have impacted her strength on the right side of her body, her memory, or her speech.
One advance that's making a difference for Christy is called Bright Matter.
By using this synaptive bright matter technology, it allowed us to visualize the white matter fiber tracks, kind of the highways of information in the brain, to visualize where the motor fibers are. So it's important to know where these fibers are to know where the danger zones are, and so that you can stay away from them during surgery.
Helping doctors get a better view is another area of advancement called the MODIS V. In the past, the problem with a traditional surgical microscope was
you are fixed in one position, and with these tumors, the tumors are just not in one spot. They're all over, they're all over the place. So you have to adjust where you're looking to look in the different nooks and crannies.
But the MODIS V is different. It's built on a robotic arm, like the ones used in space.
If you're using it in space, you can't go out there and move the arm manually, and it's all based on remote control. And in a sense, this is the same technology.
Combining Bright Matter with the MODIS V?
So you're looking at a portion of the brain, and then you can look on the screen and say, oh, okay, these are the tracks that I'm close to, and this is where I can be more aggressive over here versus I have to stay away from this area.
In Christy's surgery, this allowed more tumor to be removed, opening the door to another advancement.
In her case, after we did our resection, we were able to send it off and do genetic testing on it, and we actually were able to identify a genetic mutation, one that's actually more commonly seen in kidney cancer. Our plan is now to use this drug that's targeted against kidney cancer. We really wouldn't have that many more options as far as chemotherapy to offer her. And so what this does is it opens up new avenues for treatment.
All giving Christy continued optimism.
I'm hoping that, I'll be able to get back to work and do all that normal life things to do and just take it once a day.
Now, there is no single best answer to treating cancer, but with every advance, we come closer to changing terminal diagnoses into chronic conditions that can be managed over years. Back to you.
Really amazing technology.
That's why we use brain surgery as sort of the metaphor for things that are really hard. We say, well, it ain't brain surgery. In this case, it is. Wow.